Are we live? I think we are live. Hello, everybody. My name is Bunny Berry, and tonight I'm going to be talking to you about dystonia as a comorbidity of Ehlers-Danlos syndrome. Last June, in June of 2018, I was diagnosed with Ehlers-Danlos syndrome, which is a connective tissue disorder, as most of you watching will know because you're probably here because you have Ehlers-Danlos syndrome. So I have Ehlers-Danlos hypermobility type. It's called type 3. Hi, I see you guys starting to come in. Thanks for joining. I'm gonna just kind of talk a little bit until more people have gathered, and then I'll start going through the material. But I was just talking about how I was diagnosed in June of 2018 with Ehlers-Danlos syndrome by geneticist Fran Kendall in Atlanta, and I was diagnosed clinically. I have the hypermobility type, which does not yet have a genetic marker that can be tested for using a simple blood test or a genetic test, a swab. So they do the testing based on clinical presentation. Number one clinical presentation is hypermobility for this particular type of Ehlers-Danlos. And so they'll give you a certain set of tests to do to see how flexible your joints are and to see if your joints hyperextend past their normal range, which mine do. And I'm not supposed to do party tricks, as they call them, but I am going to show you sort of what we call the Ehlers-Danlos gang sign. And if you can do this, you might want to talk to your doctor about the possibility of having Ehlers-Danlos hypermobility type syndrome. So if you can take your thumb and you can put it on your wrist, that means that your wrists are hypermobile. They should not be able to bend that far down. Most of the time you can get a little bit of range, okay? My wrists are not really super painful. They don't cause me any problems. In fact, I am what would be considered a stiff zebra. I do not have major joint dislocations. I have more subluxations, and my joints are unstable, but they don't necessarily completely dislocate like a lot of people do. So, okay, it looks like we've got a couple of people here, so I'm going to go ahead and start. What we're talking about tonight is dystonia. And the reason that I am really passionate about this particular subject is that it's been a really long journey for me to get where I am today, so that I can sit here and talk to you about this exciting information that I found, and I think that might be able to help you. I was not diagnosed until I was 48 years old, and I've been sick, housebound, bedbound, definitely using a mobility aid, mostly a wheelchair, and a walker for the last 10 years. And ever since I discovered that I have dystonia and started being treated for it, I have gained back almost all of my mobility, at least for short distances, and also my dysautonomia, which I know a lot of people out there suffer from who have Ehlers-Danlos syndrome. I have POTS. Some people call it dysautonomia. Some people have POTS. There are different types of dysautonomia. Basically what that is a dysregulation in your autonomic nervous system. Anything that your heart rate, when you sweat, whatever. You can look it up. Dysautonomia, POTS, postural orthostatic tachycardia syndrome. Just rolls off the tongue. It's easy. Anyway, I had really severe dysautonomia, really severe POTS. And so because I was always in this fight or flight mode, I was really unaware of what was going on in the rest of my body. I always felt like I was having a panic attack. My heart was racing. My heart would be in the 100 to 200 range. 100 range when I was lying down, the 200 range if I was standing up, even just taking a shower. So the only way that I could really exist is to be flat. And it's difficult to live your life when you have to be flat, as you guys know. So because of my dysautonomia and or POTS, I really was unaware of what was going on because I was just in this constant state of an adrenaline rush. And I went to a cardiologist who put me on a beta blocker. He put me on, it's called propranolol or something like that. I don't know what it's called, but it's a beta blocker, which automatically slows down your heart rate. This drug I got put on last October, and it changed everything. I was able to then actually be comfortable standing up. I was able to be upright for a couple of hours a day, but I was still profoundly ill. I was also taking a vasovagal nerve stimulator and a blood volumizer for POTS or dysautonomia, and was drinking copious amounts of electrolytes and water and using compression stockings and compression gear. Those are the treatments for dysautonomia. So, yeah, I don't know why I'm talking about that. Okay. I found an article on the internet after my dysautonomia calmed down by using the beta blockers. I started really researching what the hell is going on. I have been so sick. And I found this article in the Journal of Alzheimer's and Parkinsonism and Dementia. Exciting, right? Okay, so they did a study of over 23 years. Okay, so this is not like something that it's been a fly-by-night study. 23 years. This article is listed in the discussion notes. There is a link to this article. You need to read this article if you are in this room tonight and you think that you might have dystonia. This article right here is going to explain everything. All right, so by a show of likes, how many of you over the course of your diagnostic and treatment for Ehlers-Danlos syndrome have been told that your mobility, your pain, your tingling sensations, not being able to swallow, not being able to breathe, how many of you have been told that these things were psychologically based? I have. I've actually been sent for psychiatric evaluations. I've been, I have a diagnosis of functional neurological disorder in my medical record, which is now being removed since my diagnosis. And basically, everybody thinks you're crazy if you have Ehlers-Danlos syndrome and you have certain symptoms that doctors cannot see. The problem with dystonia is that it's not visible on imaging. Just like Ehlers-Danlos hypermobility type, it is diagnosed on clinical presentation. So if your doctor doesn't know that there is an association between Ehlers-Danlos and dystonia, they don't know to test you for this. Yes, called hysterical. Absolutely. Hysterical, crazy. Well, I mean, they won't tell you you're crazy, but they'll say it's anxiety, it's stress. No, it's not stress. Okay, so I'm just going to read a little bit and then we'll go forward. Over a period of 23 years, we've examined more than 5,000 patients with EDS. We observed clinical manifestations of dystonia in 66% of cases. So 66% of the people that they followed over a 23-year time period had dystonia. And the wonderful part about that is that dystonia in people with Ehlers-Danlos syndrome is highly treatable. So what is dystonia? Dystonia, in the purest sense of the definition, means dysregulation of your muscle tone, okay? So if one side of your body is more muscular than the other side, that would be considered a dystonia. If one side of your face, my face looks great because I'm on medication, but you can see in the discussion photos that it doesn't always look so great. If you have a droopy eye, or your face tends to droop on one side or be more muscular on one side, if you have really super tight neck muscles, these are all signs of dystonia, which is a dysregulation in your muscle tone. It's a neurological condition. Your brain is sending a message to your muscles to contract, and it's right there in your dopamine centers. Dystonia is basically a very friendly and treatable version of Parkinson's disease, okay? Parkinson's disease is when the dopamine receptors in your brain have little proteins that collect. And because those proteins are collecting on your receptors, you're actually not able to process dopamine. Dopamine controls your movement, the coordination of your movement. So you can dance, right? If I can do this, my dopamine's working. Everything's working fine. So when you're asked to do this in a neurological exam, that's what they're looking for. They're looking for, do you have the ability or the signals firing for you to move your muscles in synchronicity with each other, okay? So that's the pure definition of dystonia. You will recognize it because muscles in your body that have been contracting like that over years and years and years of time tend to become overdeveloped. So what this says is that functional consequences of dystonia and EDS are important, contributing strongly to disabilities which often affect these patients, going against a widespread misconception of benignity, which unfortunately remains attached to this pathology, currently neglected and underdiagnosed. Absolutely true. A better knowledge of dystonia helps to better understand the syndrome and make it better known and treated. General understanding of the mechanisms of symptoms of EDS have progressed considerably and allow for the implementation of more effective therapeutic strategies, including the treatment of dystonia and its functional consequences. So basically, this article talks about how most of the patients were sent to a psychiatrist or sent for psychological evaluation because when Ehlers Danlos is presented, information is presented about it online, in conferences, wherever, dystonia is rarely, if ever, mentioned as a symptom. So because of that, we all know about the joint hypermobility. We all know about the skin elasticity. We all know about the strange scarring, right? We all know that these are symptoms of of EDS, but dystonia is never mentioned. So how would you know to ask for a clinical presentation? I'm going to show you. Most common type of dystonia is cervical dystonia, which means dystonia in your neck. There are 4 types. I have visual aids. Okay, there are 4 types. The first type, torticollis. This is what allows your head to rotate left to right, okay? You can see that I can rotate my head all the way back so that I can look over both shoulders. I want you to try to do that right now. Take your head, turn it all the way to the left. Make sure you're looking over that shoulder. Turn it all the way to the right. Can you do that? Can you do it? Can you just do it freely and easily? I could not. Before I would turn my head was always sort of turned to the left, and it would get caught, and I could not pry it. No matter how hard I tried, I could not pry it back to center. And these spasms, they would build up in my head and my neck right here. And I would feel it build up, and I would have hundreds of these spasms every day, like 300 or 400 of them every day. It would happen every 5 to 6 seconds, and be sustained for like 45 seconds, and then release, and then start building up again. Good question, Jocelyn. She asked if it's only on one side. In this article, it actually talks about how hemifacial is very common in patients with Ehlers, Danlos, and dystonia, which I have also found to be true in just looking at people's faces that I suspect may have dystonia with Ehlers, Danlos. It does tend to be really split down one side of the body. On my particular body, it's my right side, and it does go all the way down. The other type of cervical dystonia is lateracolous. That means like this, okay? Turning your head this way. See if you can do that easily. If not, if you can only go this far, or you can only go this far, then you may have dystonia in your neck. And then there's antericolous and retrocolous, which is basically forward and back. Most people have a combination of two or more of these types. Mine is to the left and back just a little bit. That's where my head naturally sits. Why? Why does my head naturally sit that way? My brain is sending a signal to the muscles in my neck to contract. And I'm going to show you what these muscles are, okay? Because this is really important. Sorry. I got a hair in my mouth. Okay. Look at her. Isn't she great? You see this muscle right here? This is called your sternocleidomastoid. That's a big word, SAT word. Your sternocleidomastoid. If you have an overly developed sternocleidomastoid, mine are not, okay? You can see mine, they're right here. Mine are not very developed. Or actually maybe they are, but I'm fat, so I can't see them, right? If you have really giant bulging muscles here, you should suspect that you might have cervical dystonia or a type of dystonia. Also, so this muscle, these, look through your Facebook photos, look through all the photos that you want to throw away because they look crappy. No, the French researchers did not say that cervical dystonia was the most frequent form seen in EDS. In fact, I think that their research said that people were having symptoms even in childhood. So I think that most people probably have generalized dystonia, which means it's spread to all the different parts of your body, including your voice, your shoulders, your arm, leg, whatever. Okay, so anyway, let's keep going through these muscles really quickly. You have your sternocleidomastoids. These are classic bulging muscle symptoms in cervical dystonia. Now, I'm not going to undress, but I am going to take my sweater down just a little bit so I can show you that. You see right here? See these muscles? You guys, look how I choose advocacy over vanity, right? All right, look at these muscles right here. You see that? They're right here. This is called your scalene. Your scalenes should be concave. Mine are super hyper developed. So you can see how they're bulging out. and also the trapezius muscles here in the back. How many of you, by a show of emojis, have giant linebacker shoulders? You have giant linebacker shoulders, when most women have shoulders that their neck goes down into a curve, into a concave curve. Mine, I mean, I look like I look like I'm seriously lifting weights all the time, right? So these neck muscles. Also here in your occipital region, okay? Here, see here in the back of your head? These muscles at the base of the skull. Holy crap. I know that half of you, actually 66% of you right now are going, oh crap, yeah. Mine is on that right side. It's very tender. It's always tender to the touch. So tight that it feels like your head's literally going to pop off, okay? So those are the muscles. You can go on Google or you can look in the documents below and find all of these visual references, okay? Yes, the spot on the back of the head. I know. I hear you, Christy. This spot, these spots right here, the occipitals. Oh, here they are. This, oh my gosh. This is going to cause headaches. This is going to cause neck aches. This is what causes your head not to be able to move up and down. All of these muscles are just so tight, okay? You can also see, let me show you why this affects you so much. And why somebody mentioned thoracic outlet syndrome. The reason you think that you have thoracic outlet syndrome, and you may have thoracic outlet syndrome, I don't know. But the reason, okay, here's my thoracic outlet. You can see I have my giant trapezius, my scalenes. Here's my shoulder, my normal shoulder, my pectoral muscle. Can you see how this muscle is actually super developed right here? All of these muscles are overdeveloped. Well, when they're squeezing like that, when my brain is telling it to squeeze, this is what it's squeezing. This is called your thoracic outlet. Here's your collarbone. So here, right here. Underneath your collarbone, you have veins, arteries, and cranial nerves right here that are running underneath your collarbone and going all the way through your face, your head, and your arms. The reason that it feels like thoracic outlet syndrome, and I think is kind of that thoracic outlet syndrome is kind of a controversial diagnosis sometimes, is because when these muscles are contracting, it is literally pinching everything in your thoracic outlet. So I had a lot of arm pain right here, tons of arm pain, lots of tingling down my arm, numbness down my arm, numbness in my fingers, of course my wrists, because of dystonia, they would kind of curl up into claws, and a lot of it I know was coming from this thoracic outlet area. Does this sound familiar to you guys? Or does anybody else have problems in this area, or in your arms, or in your face? That is coming from all of this muscle contraction of the dystonia. So when you're looking at, you can see, here's me, here is the actual outlet, it causes a lot of problems. It causes problems with blood flow. It causes problems with blood flow to the brain. Basically, everything is squished and pinched, and it's being squished and pinched by your own muscles. Now, Adrienne, I don't know that that's what it is. That's just my personal experience. And I should make a disclaimer right now that I'm not a medical professional. I'm a patient. I have had Ehlers Danlos my whole life, and I was just diagnosed with dystonia and put on medication, and it's completely changed everything. That's why I'm standing on my tiny little mountaintop shouting about this information. So, but yes, I do believe, I personally believe that my thoracic outlets symptoms are dystonia because they're gone. They're gone now. All right. Also, you guys have seen a lot of photos of my face, and in a lot of photos, my face is like this. I can do this really easily because these muscles are super, super fine-tuned now. So I can kind of make my face do this. Well, that's because all of these nerves to your face, you can see the muscles. I have dystonia here in my face, in my cheeks, in my lips, in my larynx. I have dystonia all over my face, mainly on the right side, but a tiny little bit on the left side too. So when those muscles are contracting, it is squeezing my cranial muscles, my facial muscles, my trigeminal nerve. And in a lot of photographs, you'll see that I get a really, really deep stripe of flushing on my cheek on this side and right here. And that is where my dystonia is the worst in my face. I can't describe how it feels. It feels like, I call it the torture valve. It feels like there is this intense pressure and this vice grip that's just pulling every muscle in my face like down. And it feels like I have ringing in my ears and this intense pressure. And also I have dystonia in my larynx, which means that my vocal cords will slam shut. And when they do, I have a hard time breathing, both in and out, but mainly out. And also my voice will either start to tremble. I can kind of close, I can pretend close them. My voice will kind of start to tremble, or it'll get really quiet, especially if I am emotionally upset or extremely tired. So like, I got into a really terrible argument with a friend, and when I was very symptomatic, and I literally get dystonic mutism, which means my vocal cords will close, and no matter how hard I try, just can't talk. It just stops everything. So if you have trouble swallowing, breathing out, or you have a stridor or a wheeze when you breathe out, if it sounds like this when you breathe out, that's contraction right here. Yeah, I used to have a whisper right now, Adrienne. Adrienne, you definitely, you need to see a neurologist like yesterday. Anyway, mine is very visible in my face, and that's probably the place that it's most visible, but it actually does run all the way down the side of my body. But some of the symptoms that I would have never associated with the dystonia were things like not being able to breathe, or not being able to talk, or not being able to swallow. I never would have imagined that that was all happening because of muscle contraction. I personally thought that it was mast cell activation syndrome. which I do have. I do have mast cell activation syndrome, but that is not what was causing what I thought was anaphylaxis. I thought I was having anaphylactic reactions, but it was actually that my larynx is closing, and so it would make it very hard for me to breathe in and out. And I would feel like my throat was I feel like I'm being strangled, or that my throat is closing up like an anaphylactic reaction. Also, my sinuses. We're just made of muscle. I mean, we are muscle machines. And so even my sinuses will contract and constrict. And so my sinuses feel clogged, and like sometimes I feel like I can't breathe in or out of my nose. But there's no mucus. It's not like when you have a cold and you blow your nose and stuff comes out. It's just this inability to breathe, which really hinders your ability to think as well. Because if you're not getting enough oxygen to your brain, then obviously you're going to have problems thinking. So yeah, the whistling sound, swallowing, if food gets caught, like here, and doesn't want to go down. Also, any numbness, tingling, pain, burning. This side of my face would get so flushed and swollen and burning red that it absolutely just, I have to put an ice pack on it and be in bed, in the dark. Also, you can see it right now. I don't know what time it is, but it's 8 o'clock. So I'm 2 hours into my last dose of Levodopa, and you can already see that my eyes are starting to go. My eyes are a big problem for me. My eyes I have all these words are so hard to pronounce. I think it's called blepharospasm. Basically what that means is that your eyes will blink uncontrollably, or you will feel, for me, mine don't do this. Mine don't blink uncontrollably. That's how a lot of people's dystonia shows up in their eyes. Mine instead feels like my eyes want pressure on them, and so I do a hard blink like this. I'm voluntarily doing that blink, but I'm doing it because I have to. That's a strange sensation, but that is one of the definitions of the way dystonia and Parkinson's work. If you feel like you cannot help moving a muscle, that is a possible dystonic motion. If my eye just droops naturally, and I'm not doing it right now, I'm doing it, but if it droops naturally, it's usually because this side of my face has been engaged for so long, and these muscles have been working so hard that my face will start to droop. Right? So these are things that you can look for in your face. Because dystonia is a movement disorder, it's not always going to look the same in your face every single time you take a photograph of yourself, okay? Because sometimes you're going to be in the tired, oh, it's so tired, and everything's drooping phase. And then sometimes I might be in a grimace where I can't help it. And sometimes I might just look normal, except if you look, you can see that this nasolabial fold is deeper than this one. And one side of my face in photographs normally appears bigger, fuller, wider. And I see it all the time in your photographs, okay? I don't even have to open them. I can see it in the thumbnail. Just go through your photographs on Facebook, go through all the profile photos that you've put up, and look, split your face right down the middle, okay? In your photo app, there is usually a a ruler or a way that you can split your, you can split your face down the middle with a line. So do that. Take a line, put it straight down the middle of your face, line it up with your nose, okay? Because that's where the center of your face is. This little section right here, your lips, okay? My eyes will actually get like this, okay? So they'll be at like a 10-degree angle on my face, asymmetrical. Or my cheek will be asymmetrical. Or my shoulders will be asymmetrical. Or my entire body, my arm, my leg, I might be having just, I might be just standing on my tiptoe on my right foot because everything on the side is jacked up. And it's not controllable. I can't control it, but it is absolutely exhausting. So that's the definition of dystonia, kind of how you might be able to recognize it in your face. Take your face. You'll see lots of examples where I have split my face up. Go look at other people's photos. Look at their profile photos. If you can instantly recognize that one side of the face is bigger than the other in a photograph, you probably should start being more aware and documenting asymmetry in your face or in your body so that you can pass that on to your neurologist or general practitioner and ask them to be assessed for dystonia. Everybody's going to ask, yep, I know, jacked up on one side with shoulders, yeah, shoulders like a teeter-totter, right? Mm-hmm. Mine is always the right side. That's another thing that I have found in just talking to you guys and looking at your faces is that we all tend to be one-sided. I have it generally, but definitely more severe on one side. You may think that the side that does not have dystonia is your weak side. It's really not. My left side is my normal side. My right side is the one that's getting the signals to contract all the time. So my right side is actually much more muscular all the way down. My bicep, my thigh.
But they tire.
Yes, but they do tire. Thank you, Basil. They do tire, and when they tire, it wears out.
Feels weak.
And you feel weak. You feel very fatigued. One of the major symptoms of dystonia is fatigue. And let me talk about a very specific pattern that we tend to have. It's called a diurnal fluctuation, or diurnal is the opposite of nocturnal. So it means that your symptoms, you may wake up feeling kind of okay because you had some restorative sleep. Maybe if you can get restorative sleep. I can't sleep. I have the most chronic insomnia that you could ever imagine, and it's crushing, soul crushing. But if you wake up and you feel kind of refreshed, and then you hit a certain time in the morning, mine could be anywhere from 9:30 in the morning to 11:30 in the morning, all of a sudden the dystonia starts to ramp up. And when it ramps up and this torture valve turns on and I can feel my body I can feel my arm literally twisting. It's so subtle. It's not like a jerk. And that's what your doctor is expecting. Your doctor is expecting you to come in and say, I can't stop doing this, right? Because that is what a lot of dystonias look like that are not responsive to dopamine. There are certain types of dystonia where the basal ganglia in the brain is actually damaged. And those people will get a very jerky, an uncontrollable jerk. I've never had anything like that, except I did have a few years ago, I would have these full body myoclonic spasms where my entire body would just seize up for hours at a time. That hasn't happened in a really long time, but it still is constant. It's happening every every couple of minutes for maybe 45 seconds at a time. So this diurnal fluctuation, you wake up, you feel kind of okay, it starts ramping up. By about 3 o'clock, you have got to be lying down. By 7 o'clock, you're probably saying, oh my gosh, I have to go to bed. By 9 o'clock, you're begging somebody to just kill you now. And that pattern happens every single day. So it's called a diurnal fluctuation. It is very specific to this particular type of dystonia, which is called Dopa responsive dystonia. Sorry, let me just readjust here. So, what do you do if you suspect that you might have dystonia? Yeah, I know, Jocelyn, that schedule is crazy. Look up Sagawa syndrome, S-E-G-A-W-A, Sagawa syndrome. The doctor who named Dopa responsive dystonia was named Sagawa, and that particular diurnal fluctuation is very specific to Sagawa syndrome. So look that up if you want to learn more about the diurnal fluctuation. And if that diurnal fluctuation matches your symptoms, you should be assessed for dystonia. Okay, so what happened? I found this article, right? I found it. And it's got the treatment protocol right here in the paper. Right here. All right, first of all, 66% of the people had it. And what they did is they tried a Parkinson's medication, because dystonia is basically the same thing as Parkinson's disease with different causes. So, the treatment protocol is written in the paper that they started patients on a drug called Levodopa. Levodopa is basically synthetic dopamine. It's synthetic Ldopa. It's the precursor to dopamine. So you take Ldopa and it converts to dopamine in your brain. And when your brain has enough dopamine, it can sync those muscles back up, your face, everything balances out. One thing that I did not expect is that with Levodopa, it also comes with it's a combination medication. It comes with a medication called Carbidopa. Carbidopa, I say it's the car, right? It's the car of the Levodopa. Levodopa needs Carbidopa to pass over the blood-brain barrier to get converted into dopamine. So Carbidopa and Levodopa typically do come together, and that's not mentioned in this article, but a neurologist who knows about movement disorders will definitely combine them. Carbidopa. Interesting fact about Carbidopa. If you have POTS, especially if your POTS has been identified as hypergenic POTS or hyperPOTS, Carbidopa has actually been researched by the Dysautonomia International Foundation, and they ran a trial and gave people Carbidopa for their hyperPOTS. Guess what? My POTS has gone from a full-on roar where I could not be upright for more than 2 or 3 minutes without my heart rate going through the roof. If I stood for a full minute, I would be drenched in sweat. Adrenaline surges like crazy all the time. I was in a constant state of panic. And I don't know if it's the Ldopa that's converting into dopamine and that's fixing the problem, or if it's the Carbidopa, because Dysautonomia International did a study on it. But if you have dysautonomia and you think that you may have dystonia, please talk to your neurologist about, or your cardiologist. If you take the information, you can find it on Dysautonomia International. If you take that information about the Carbidopa trial and hyperpots to your cardiologist, they can probably give you a trial of this medication too. My heart rate now is between a cool 58 and 100. It went from being 100 to 200 to being 60 to 100, which is perfectly normal. So this medication right here replaced vasovagal. It replaced the blood volumizer. It replaced the beta blocker. It replaced diazepam, Valium, and it replaced muscle relaxers. Carbidopa, Levodopa treated my dystonia and my dysautonomia. And I would say that I'm still, I still have days where I'm really ill. I still can't walk super long distances, but when I do, I'm not swinging one leg. If you're swinging a leg out when you're walking, it may be because you have a tiny bit of a foot turn, okay? If you have dystonia that's going all the way down your body, your feet, stretch your feet up, like put your legs out, let your feet rest, and if your foot turns in just a little bit, that's probably dystonia that's causing your foot to turn in. My foot not only turns in just a little bit, my toes also curl under. So I'm trying to walk on the side of my foot all the time, which basically, when your toes are curled under and you're walking on the side of your foot, it kind of renders your foot useless. So don't just focus on your neck and your face. You could have contractions that you feel when you're falling asleep. Like if you're jerking awake, if you're falling asleep, everybody does that sometimes, okay? That's normal. But if you have restless leg syndrome, if you have really intense myoclonic jerks when you're falling asleep, that is definitely a sign of dystonia. If you have any involuntary muscle spasms in your body, maybe sometimes you realize that you're holding your breath. I do that a lot. I realize that I'm holding my breath, and it's not because I'm holding my breath, it's because I'm actually contracting my stomach muscles. And I have to really breathe through it, okay? So it could be any muscle in your body. I put this on our little document thing down here. You can print this out and you can actually circle all the parts of your body where you feel dystonia. This is mine, okay? My face, my larynx, my shoulders, my neck, my all the way down, my foot turns in, my lats on both sides. I mean, I could just keep marking this up. It's just, it's everywhere. It's all the way down my back and all the way down the right side of my front. So somebody said, oh, your restless leg syndrome was off the chain before you went on Sinamet. Yeah. I mean, if you have restless leg, Sinamet is the brand name of Carbidopa, Levodopa. if you have restless leg syndrome, this medication is prescribed for restless leg syndrome. So it's not like it's some horrible caustic medication that's going to destroy your life. It actually is, it's prescribed for restless leg syndrome, Parkinson's disease, dystonia. They will always try you on a trial of Carbidopa, Levodopa, because the other treatments for dystonia that are not responsive to dopamine are Botox injections. You have to get Botox injections, like hundreds of Botox injections on your neck and face and down your body. Or some people that don't respond to any of those treatments actually have to have deep brain stimulation, where they put electrodes down on your basal ganglia and you have a pacemaker to your brain that keeps everything in coordination. But we are very fortunate in the fact that people with Ehlers-Danlos syndrome tend to be responsive to dopamine. And it's in this article. It's all right here. So really quickly, I'm going to wrap this up. You guys, all the materials, I put together a bunch of materials in the discussion notes so that you can see all of these visual aids. You can find this article. You can see lots of photographs and videos of me with my face in different levels of spasm. Sometimes it'll be in spasm, sometimes it's drooping, sometimes, so you can start to recognize it maybe in your own face and in your own shoulders and neck. You can just you'll know what to look for, because right now people don't know what to look for. All right, so if you have all of these symptoms are listed in the paper. Like, can you guys tell I didn't prepare? I just created some visual aids. I'm just winging it. Okay, so involuntary segmental muscle contractions, hemi-face contractions by jerk or persistent tension. Okay, that's important because it's not always going to be a tick. Sometimes it's going to be sustained. You don't even notice it. If you're just looking at me, talking to me, and I'm moving my face and I'm smiling or whatever, you might not even notice it. You might not even notice it in yourself. It's that subtle. It can be that subtle. So it can also occur on the anterior thigh, reminding you of a vibration of a mobile phone. So it might feel like your phone's vibrating in your pocket. Anybody ever feel that? Anybody ever feel like their phone was vibrating, like on their arm? You know, just a vibration. My vibration happens here in my chest, and it feels just like a little tiny shake. Okay, just a little tiny shake. And I mentioned it 100,000 times, and no one's ever taken me seriously. It's psychological. Psychological. It's not psychological. It's actually dystonia. So the vibration, it's right here in the article. Vibration, like a cell phone, says it right there. Abrupt movements such as bursts of the shoulders, forearms, hand, head, lower limb. We've all had these, or I mean, most people have. We all think it's normal because we've had it our whole lives. We've had it. This is a comorbidity. This isn't something that just cropped up. We've had it as long as we've had Ehlers-Danlos. It's just something causes it to express itself, like, and it's hormonally indicated in this paper. So if you do have jerks like this sometimes, or like sometimes I'll be painting or I'll be doing something and I'll just throw my pen, you know, my pen will just fly across the room. And it's crazy, you know, and I'll think to myself, that's weird. Okay, so abrupt movements, involuntary segmental muscle contractions, trembling fingers at rest with your hands outstretched. Okay, so put your hands out. If you've got little trembly fingers, symptom. Trembling movements or jerky hands, resulting in clumsiness or ineffective gestures, sometimes occurring in overwhelming crisis during several minutes at the level of both hands, for example. All right, yes, clumsy to the nth degree. This one, the trembling movements in the hands or the jerky movements in the hands with clumsiness, here's a perfect example of mine. I have the hardest time spreading cream cheese on a bagel. I have the hardest time flipping a pancake, flipping an egg, any kind of flipping motion like that. I cannot do that. It's just clumsy and weird. Both of my hands just get symptomatic of dystonia. Also, I have a tremor in my left hand. So my left hand, if I'm trying to take photos, right? Trying to take a photo with my iPhone. That's why I get a lot of blurry photos or just miss the picture completely. Trembling movement, jerky hands, When holding a pen or pencil to write or draw, the fingers are tense and curled up, both because of dystonia and to stabilize the hypermobile finger. Okay, so we all know this, right? We all see this curve right here. Ow, ow, hurting. Right here, writer's cramp. Writer's cramp is a form of dystonia, okay? Form of dystonia. When your hand goes in and just sucks in like that and contracts. Yep. Yep. Intermittent muscle contractions described as feeling of painful hardening, rigidity, curbing movement, cramps, or being stiff. Christy says she can barely write with a pen anymore. The muscles forget what to do. That is exactly what's happening. The muscles are forgetting what to do because they're not being fed that dopamine. And when the dopamine is there, they remember. It's all, the information's all there. I promise. You have not lost it. It's all still there. It's just out of sync. Okay. So being stiff, hardening, hard muscle, any muscle that contracts and won't move. Permanent contractures, forced flexion of the wrist and fingers. This is me when I'm sleeping. You sleeping? Benign tremors. I don't know what a benign tremor is. What the hell does that mean? I mean, if somebody told me I have a benign tremor, I'm sorry, that just sounds like lazy medicine to me. You have a benign tremor. Okay, that's fine, but why? That'd be my question. Why? Why do I have a benign tremor? What's causing it? A benign tremor? I get pissed off when I hear stuff like that. Repetitive, incessant movements of flexion or extension of your feet and knees if your feet are in contact with the ground. Oh my gosh, I cannot believe that this is a symptom. I don't know how to show you this. When I'm sitting and my feet are touching the floor, I always have I have my tiptoes. The balls of my feet are engaged and my knees are engaged. So it's really engaging my thighs as well. My feet are always, hold on, let's see if I can show you. It's this. Can you see that? That's the way my feet are whenever I'm sitting. Could you guys see that? Weird, because that's an actual symptom written on here. I've done that my entire life. Repeated alternating movements of great amplitude. Flexion, extension of the trunk or the lower extremities. Mary Boyd. the flexion extension of the trunk. Those spasms in the trunk, in the front, in the abdomen, in the abs, and in the lats on your back, that is truncal dystonia. And occurring, blah, blah, blah. This was observed in a 6-year-old girl, and it disappeared completely under the treatment of dystonia. Of Ldopa. Diffuse contracture attacks associated with neurovegetative type manifestations, often referred to as spasmophilia. I think that what this is actually talking about is like what I call an awake seizure. It's where my body just tightens up and I can't move, but I'm completely awake and I'm aware of everything that's going on, but I cannot move. I think that's what that's talking about. Diffuse tonic seizures in the lower extremities with alternating violent movements increased by attempts of forced immobilization. So for example, if my foot's like this and I try to straighten my toes out, I can't. No matter how hard I try, I cannot straighten them out. Or no matter how hard I try, I cannot move my head to the other direction. Okay. Hemi body. That means half your body. Hemi body or whole body tonic seizures with sometimes attitudes. Yeah, I got some attitudes, all right. Possibility of wounds or hematomas. So you can actually, those bruises you get that you're like, why do I have a bruise right there? These spasms can be so strong that they cause bruising. In fact, my spasms in my jaw are so strong that they break my teeth. I just had to have a tooth removed because my jaw will clamp down so hard that all of my teeth on the top are broken. So hemi or whole body this can dislocate your joints, okay? You could have a dystonic, a myoclonic seizure, like a little jerk. It could just pop your shoulder right out of a joint. At night, there's restless leg syndrome with movement, sometimes wide and violent. And listen to this one. This one is the one that I was like, are you kidding me? Bruxism. Bruxism. Do you guys know what bruxism is? Clenching your teeth. How many people hit an emoji? How many people watching right now clench your teeth? My teeth used to be so beautiful. They were big and strong, and now I have not ground them. I don't grind. I clench. I clench so much that my canines have no points. My teeth are all super tiny, and they've been ground down to tiny little nubs because of bruxism. And you know what? One dose. First dose. Bruxism. Gone. Now I take this every day. I don't have bruxism anymore. I don't clench my teeth. Sorry. I had braces. I've been, I've been called a dental cripple before because of my bruxism. I have a very hard time, for years I had a very hard time keeping my mouth open long enough to have like dental exams. And so I kind of, had to let my teeth go because I literally could not sit through a dental exam. Now I can, and my teeth are kind of a mess, but but I'm working on it. But the bruxism causes bone growth in the top, in your upper and lower jaw. So I don't know if I can show it to you. I don't think you can see it, but if you like look, you can't see it. If you look up here, if you're a really, really bad teeth clencher, if you look, you might see white bony growths on your upper gums and your lower gums. That's from where you've clenched your teeth, and it's actually created more bone density in that gum area. I've been doing that since birth. Since I had my first tooth, I've been clenching it. So those are all of the symptoms that were listed in this particular document. And I think that you can see that a lot of people that you know, or a lot of people that are watching this right now, probably need to be assessed for dystonia. And the case study that they did, it was a 28-year-old girl that they did a case study of how her Levodopa treatment went. Okay, they said questionnaire-based study. Okay, comparing their treatment before and after 1 month of treatment. These were 25 people answered the questionnaire. 22 questionnaires were usable. 3 people stopped treatment because of side effects. The most common side effects are nausea. Some people have really bad nightmares when they first start. Some people will have dyskinesia, which is when your face or your body twitchy, really twitchy. If you take too much dopamine, you can, or too much Ldopa, you can get that. But listen to this. 3 people stopped treatment because of side effects. Positive responses to treatment appear after a delay of 5 to 20 days. I could not walk for 10 years. And after 8 days on this medication, I walked a mile. Okay? 5 to 20 days. I personally felt the effects of Levodopa after the first dose. Day 3, I knew it was working. Day 8, I got up and walked a mile. It took a while for me to get up to my therapeutic dose, but even the dosage information is in this research paper. So print this out, take it to your doctor. It's got it exactly outlined where you should start, okay? So, the effects on dystonia are the most marked. 82% improvement. 59% of people improved significantly, or what they call exquisitely. 82% improvement after starting Levodopa. 59% of people responded exquisitely or significantly. Those are really, really, really good odds. Yes, Zoe, 3 days, right? Me too. About 3 days. I was like, oh my, what the F? Okay, so, 82% improvement rapidly within a few weeks. There are other positive effects on muscular and articular pains, on the ease and fluidity of voluntary movement, and your ability to find yourself in space. It's a P word. It's a P word. You guys know what it is. You guys know what the P word is. Precipitation. Whatever. What that is basically, it's called your sixth sense. It's how you know where you are in space, your balance, right? So rapidly within a few weeks, I agree with that. autonomic dysfunction, cognitive function improvement. I mean, within a month, my brain just came completely back online. I thought that I had early onset Alzheimer's disease or a brain eating amoeba, because I was so absolutely, I had no cognitive function. I had no memory. As soon as I started it again, started the Levodopa therapy, my long-term and short-term memory just zoomed right back. Yes, you guys know. Yes, see, you guys all know what the P word is. Pro. I can't pronounce it. I'm not a doctor. If I was, I'd give you all a prescription right now. Okay, patients, blah, 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 blah. Everybody felt better, blah, blah, blah. Patients are observant about their treatment. Stopping the medication very quickly relapse of all your symptoms. For me, it's about 4 hours. I have a 4-hour window. I have to take medication every 4 hours. I start feeling my wear off happening at about 3 hours. Sometimes during my period, I have to take it every 3 hours. Hormones. Okay, so if you stop, if I don't take it, I'm going right back down. I'm going right back down to where I was before. Zoe said hers is 3 to 4 hours too. I think that's pretty common. From what I've read with dopa responsive dystonia, that's a pretty common wear off time. All right, so this girl, 28 years old, she was on Ldopa treatment for 28 months. Answers to the questionnaire: what dosage? She took 62.5 milligrams 3 times a day. Have you had positive results? Yes, and immediately. At the first dose, my pain, bone, muscle, and cutaneous, decreased by half. Bone. I used to be able to feel every single joint in my body. It hurt. If my joints were touching, if my bones were touching each other, it was so painful, I just wanted somebody to amputate my legs. Gone. Much better. So, blah, blah, blah. Yes, and immediately at her first dose, she found the Levodopa to be more effective than any analgesic tablet that she had tested, including codeine, morphine, and all other opiates. Do you guys hear that? Voluntary movements, yes, positive effect on bursts during the first phase of sleep. So the jumping awake really improved. I even had bursts of the body which woke me up and hurt me. I do have to take, just so you know, I do have to take an extended release at night, because if I don't, because of that 4-hour wear off time, I will wake up and I feel like I have the worst flu. I feel like I have a fever. I get chills. I feel like I did before I started the medication. I always felt like I had a fever. I always felt like I was sick. I always felt like I had the flu, and that resolved itself. So I do take an extended release at nighttime. Decrease in involuntary movements of the hands. She had very strong arm and leg tremors for no apparent reason that disappeared. Her hands and legs were sometimes blocked in certain positions under the effect of muscle contraction. I can be up at 11 o'clock at night now, sitting up. Yes, on dislocation and subluxation, much better recovery of joint function after dislocation and subluxation. Better sleep. Other effects. She regularly felt electric shocks and peaks of pain in limbs and body, as if she was plunging a needle into the muscle. Anybody ever feel that? Like this sharp stabbing pain in your muscle? Hers was resolved, and so were mine. Are these effects lasting? Yes. Since the day I took Levodopa more than 2 years ago. Have you observed adverse side effects? Yeah. At the beginning of treatment, she had sleeplessness and terrible nightmares that resolved after a few weeks. She has been able to suppress many medications in recent years, but Levodopa is the one I cannot live without. Okay? The one she cannot live without. The one that I cannot live without. I hope that this has been informative, and that you will go and read this article. It's 5 pages, guys. It's 5 pages. It took me 15 years. 5 pages completely changed my life. Now, don't be pissed off at your doctor because he or she doesn't know about this research. The reason they don't know about it is because, well, it was done over a 25-year period, and it was published on June 9th of 2018. That was the day that I was diagnosed with Ehlers-Danlos syndrome. So this paper was not even published until I was actually diagnosed. Basil, can you call Beckett? He keeps calling my phone. So, yeah. It's brand new. Your doctors don't know about it. They don't know about it because it's in a Parkinson's and dementia and Alzheimer's journal. And it needs to be out in the EDS community. 66% of people with Ehlers-Danlos have dystonia. And what did they say? 59% were exquisitely responsive, and over 80% were responsive to Levodopa. You guys, I really, this has completely changed my life. And I just want you to know about it, and I want you to pass it around, and I want you to give it to your doctor, and I want you to make sure your doctor reads it. What I did is I just called my doctor's phone, and I would just read a paragraph and say, oh, it's going to cut me off. And I would hang up and call back and read another paragraph and hit all the highlights. And I asked for a trial of Carbidopa, Levodopa. Yeah, right, Chris. It does. It takes a long time for the research to actually get out there. So even though this was done over a 23-year time period, it was it was literally just published in June. Zoe, this folds up. I mean, it rolls up really nicely. You just roll it up like this. You can either shove it where the sun don't shine, or you can just, you can use it. Give it to them. Say, can you read this? Can you maybe give me a trial? And then, do you guys have any questions? Your neurologist at Emory was familiar with that article? Oh my, that's awesome news, Chris. I'm so happy to hear that. So I'm going to be here for a few more minutes. If anybody has any, any questions that they want to ask about particular symptoms that I might have experienced or that you're experiencing that this article has resonated with you or this conversation has resonated with you. Chris, pass your information, doctor information, onto Mariah because, okay, you did. Thank you. Thank you so much. Honestly, any neurologist who has gone to medical school should be able to assess you for dystonia. okay? Especially dystonia of the neck, which I believe is so super common, because this is really, I mean, this is such a crux of our stability. Oh God, Jocelyn, you can't ask me that question. Who is my neurologist? I'll never tell. I got in big trouble for talking about my neurologist on Facebook. He tried to fire me as a patient before I got my diagnosis. And so I don't talk about him. But he doesn't know anything about dystonia. He didn't know shit about it. In fact, I was misdiagnosed twice. Once with myasthenia gravis and then with stiff person syndrome. And I went through severely invasive autoimmune treatment for 7 years before going to Mayo Clinic and having them tell me that it was not, in fact, stiff person syndrome. Mayo Clinic did send me away with absolutely no answers, which is shocking to me and really disappointing. I went to Mayo Clinic in Minnesota and walked away with a diagnosis of myofascial pain, which means, ow, I'm really sore. My muscles are sore. Yeah, Mayo can. Any other questions? I will say I saw Dr. McKeon at Mayo Clinic, and he did not recognize dystonia in me. And even when I talked to him about very specific symptoms like being split completely down the middle of my body, I even told this man that I could only feel one half of my clitoris. Okay, hold on. You guys ready? I told him that I only had sensation on the right side of my clitoris. He'd never even stopped typing. He just kept typing. He didn't even look up. And I was like, did you hear me? I mean, I don't have any sensation on the left side of my clitoris. And, you know, I always joke now, like, can you imagine if my husband walked into the goddamn Mayo Clinic and said, I can't feel half my dick? I mean, they would have an emergency team, a unit of penis doctors rushing in to save him. We're gonna save your penis, don't worry. They don't care about your clitoris though. So, yeah. If you are split down the middle, that is a neurological disease. It is not autoimmune. Okay? It's not autoimmune. If you have something going on just the right side or the left side of your body, that is neurological. Chris says, I asked so many doctors why all my injuries were on the same side and no one knew. You know, like I said, we really can't, I don't think we can blame them because dystonia is literally never mentioned in the symptom list for Ehlers-Danlos syndrome. And if it was, people wouldn't even know what dystonia was. People do not know what dystonia is. I tell people that I have a kinder, gentler form of Parkinson's disease because everyone understands Parkinson's, but dystonia, it's the same exact disease with a different cause, and your neurologist should know about it, but your other doctors probably don't. Yeah, they think it's psychological. I mean, it's right here in the article. In fact, in the article, it says that most people get sent to psych, and that it actually says in this article that if you have a patient with Ehlers-Danlos syndrome and they are exhibiting symptoms that you can't put your finger on, that you may think are psychological, then you should assess them for dystonia. You're so welcome. I'm glad that you guys could make it. Christy, I definitely know that you need to be assessed. Chris, I'm so happy that you're on medication. I've been reanimated. I mean, literally brought back from the dead. I feel like Lazarus brought back from the dead. It's not perfect, but I will take any improvement. I said I would be happy with 25% improvement. I've had way more than 25% improvement. So thank you guys for watching. If you have any other questions, just post them down below. I'm sorry I'm not able to, I was offering to do facial assessments for people, and my link got shared out to a EDS group that had like 7,000 members or something, and my inbox got so flooded that I still haven't gotten to the bottom of it. So if I do see you in person, I'm certainly, of course, more than happy to look at your face and your shoulders. Also, if I see something, believe me, some people in our local EDS group know that if I see a photograph of you that looks suspicious to me, I might mark it up and send it to you. So go mark up some of your photos, start paying more attention, and read this article and talk to your doctor about Carbidopa, Levodopa. I'm not a pharmaceutical representative. I do not make any money off of this drug. So I'm not a medical professional. All of this is my own personal experience. I love you guys. Thank you so much. I hope, cross my fingers for you, that you will experience the same type of whammy in your life that I've experienced. Mwah. Bye-bye.